everyone. Thank you for attending our last practice manager meeting of 2025. We are very happy to spend a little time with you during your lunch hour. So our agenda for today, we are going to have Jana Darlington, our Director of Provider Network Management and Payer Relations, review our health plan updates, our 2025 Vatica performance, and then we are going to turn it over to Mark Cronin, our Chief Operating Officer, to review some year-end priorities we have and our vision going forward. We will have time at the end for open discussion. So if you have anything on your mind, feel free to add that to the chat and hopefully we can answer that with you today. So Jana, I am going to send it over to you.
Perfect, thanks. So today we're really just talking about our 3 employer contracts. So we like to do this as we're wrapping up the year to give you guys some context about relevant changes that are coming as we move into the new year. So most of the changes here are kind of minute, but they are still relevant nonetheless, so you should be aware. When we look at the Thompson Health Plan, really what we're seeing here are increases in their deductibles for the Tier 1 and Tier 2 benefits, and then increased HSA and FSA contribution limits. These are set by the IRS, and so the plans adjust over time to meet those. There's also been some other minor changes that we'll review. So as we look at FF Thompson, just a quick reminder about the size and the plan details. So this is about 1,600 members. I think they're up a little bit more than that at this point. Their TPA is Excellus, Blue Cross Blue Shield, and their plans are really a high deductible health plan and a higher deductible health plan. So we'll get into the details of each of those. Both are eligible for HSA contributions. There's a 3-tier benefit, AHP, Excellus' national network, and then out of network. Plan members do not have to select a PCP, and preventive care is covered at 100%, whether they're in the AHP, they're utilizing the AHP or the Excellus network. And then FF Thompson does contribute to HSAs for single and family plans. So as we get into the details, you will see a higher deductible. The higher deductible plan has actually seen a decrease from 3,400 down to 3,000 for the deductible. And that's really the biggest benefit change here. The plan continues to cover, I told you it'd give out. The plan continues to cover 80% after the deductible is met for Tier 1 utilization of the AHP network, 70% after the deductible is met for the Tier 2 network, which is the Excellus National Network, and then 60% after the deductible is met for the out-of-network, which is anyone who's not an AHP or Excellus. So that remains the same. As we look at Highland, Highland has had a bigger change, though it shouldn't have too much impact, but still, again, relevant. The biggest thing is an increase in the deductible for HSA Saver Plan, and they have removed MVP as a TPA going into 2026, so they are only on Excellus now. Discussions with the plan, it looks like this should impact fewer than 150 members across their health plan. They obviously will have new cards issued. So just as you're seeing people who were previously on the Highland Health Plan MVP benefit, to just make sure that you're capturing new plan information for them. Go ahead. Okay. So again, this is about a 3,800 member plan. That's the Excellus BCBS TPA only now. They have HSA Saver, Healthy Basics, and Healthy Advantage, very similar to the other plans, eligible for HSA. This is really a 2-tiered benefit. Out-of-network coverage does vary, so we'll show that, but they do prioritize those AHP and Excellus tier heavily. Same thing, preventive care is covered at 100%. For at least one of the plan, there is no out-of-network benefit coverage. So if they're not utilizing an AHP or an Excellus provider, they do not have coverage for those services. And then they do contribute based on pay bands to the HSA for single and family contributions. So those are just listed there. But what does that all mean? And so as we're looking at this, the easiest way to kind of show this information is
Wright County Family Medicine. This is Jackie.
We've seen some increases in the deductible here. So those have gone up 1,700 and 3,400 for the individual or the family on the HSA Saver plan for the preferred network. As we get into Excellus, we've seen some slight increases here, 2,250 to 4,500. And then out of network coverage is available for this plan, 4,000 and 8,000 are the deductibles based on whether you're an individual or a family member. Co-insurance, we've seen those. I'm sorry, I'm on a really tiny screen, so I can't see my numbers here. But the most relevant thing is when we're looking at the out-of-network tier, it will be the same here for Healthy Saver and Healthy Advantage. The plan pays 60% after the deductible, but this does not cover any of those preventive care services. So the plan is essentially saying that they need to be seeking preventive care services from a provider that is in either AHP or the Excellus network to have those benefits covered. The Healthy Basics plan has remained pretty consistent with some moderate increases, I believe, in the deductible for the Excellus tier. And then the plan pays 70% after the deductible for that tier 2 benefit. This plan does not have any coverage for out-of-network providers. So this won't apply to you all because you're all in AHP, but as you're directing your patients to specialists, etc., it's really important, especially for this specific plan, that they stay within the AHP or the Excellus network. And then similarly, we've seen changes to the Healthy Advantage plan for the deductibles on the Excellus tiering, and then changes on the percent that the plan does cover. Nothing substantial there outside of the MVP change. And then one of our favorite plans to talk about, because it is the biggest and sometimes most complex, we have the UR Health Plan sitting right around 38,000 members. I think it may have even increased going into the new year. They have remained only with the Excellus as their TPA. Obviously, they have their copay plan and the high deductible plan. Again, 3 tiers of benefits, no PCP required. The HSA plan is eligible for HSA contributions. Preventive care is covered at 100%. This, the university does also contribute to the HSA for plan members who are making below a certain salary cap, and that has increased for this year, or for 2026, up from 64,000. So as we look at what that actually means, they have made some more significant changes here. So you guys will want to know that. The deductible on the HSA has increased slightly. Again, this is kind of staying in line with IRS contribution limits, etc. What's important here is as we get into physicians' office and diagnostic lab services, which are most relevant to you all, there have been changes to the co-insurance that they cover. So tier 1 providers, so that's use of the AHP network, is covered at 85% after the deductible is met. That used to be 90%. And then as we look at the tier 2, which is the Excellus network, that is now 65% after the deductible. That used to be 75%. So the 60% on the tier 2 or the tier 3 out of network, that has remained the same, but they've highlighted that in blue just so that people are aware that there has been a change to that line item, I should say. We've seen similar things happen with emergency and ambulance use. So where the plan is now paying 85% after the tier 1 deductible, that used to be 90%. And then we're also seeing this in urgent care for the Excellus network. So the plan is now paying 60, or I can't even see that. I'm sorry, my vision is awful. The plan is now paying 65%, and that used to be 75%. So we have seen those changes happening for this plan. those are the most substantial ones that we wanted to talk through. So before I move on to the next slide, are there any specific questions that folks may have about this information? No? Okay. So, we like to remind folks about, escalating claims issues. So the very first thing to do is reach out to the TPA for each of the plans. This has now also become more streamlined because there is only one TPA across all 3 plans. To contact them to make sure that they are, showing you as a tier 1 provider. And then if they say, so this is kind of the script to start there. If the service is not tiered, so there are some things that are not tiered under the university's health plan, but the claim is processing with a tier 2 copay or something like that, you can also convey that information here. And then what do you do next? So if they have not, if they're not showing you as a tiered provider, reach out to AHP. There could be an issue with a, provider's NPI not pulling through to the TIN, or if there's been a change in TIN, at the practice or something like that. So all of those might contribute to the claims not processing correctly. And so we'll be happy to help you navigate those if you run into any of those issues. So we will now move into Vatica's performance for 2025. This is an initiative that we've worked on for several years, and we have some 2025 goals that we're trying to meet. We've communicated and worked with some practices throughout the year. And so we just want to highlight this for our last push here as we look towards the end of 2025. So a quick reminder for everyone, what is Vatica? This is a payer-sponsored, it's cloud-based primarily, but they have done some EMR integrations now where providers are guided through a risk coding exercise that helps them capture, hierarchical conditions for payers, for patients who have high needs. So this allows providers to make recommendations based on the tools and the information that they receive. The program is specific to adult patients. We've inquired about pediatric populations. That's not a space that's being explored yet from a payer perspective, but we have inquired. This is available for all lines of business. So patients in the Medicare, commercial, and Medicaid populations are pulled in as we're looking at these eligible members. So how does it help you and how does it help patients? The biggest thing for patients here is that risk adjustment can lead to improved care. We've seen some cases where, we partner with Vatica and they've seen a specific imaging result not being conveyed back to the provider's EMR, so they're not aware of it. Some conditions are being managed outside of the PCP. Things like that. So we're able to surface that information so that you can have a much more holistic view of the patient's care. And this does allow you to be proactive in managing their health and identifying, potential complications earlier, so you can take preventive measures. For the provider's perspective, this does also reduce chart audits for the payers who are participating in Vatica. So while we primarily work with Excellus on this, there are several other payers, Excellus, MVP, Fidelis, WellCare, and there's more who are participating in the Vatica program. And so for them, you will likely see reduced chart audits because you're kind of doing those throughout the year. This, again, lets you better coordinate care with your peers for treating your patients. And then we have negotiated a higher incentive. Most payers do incentivize these visits. AHP's negotiated a higher incentive for those practices and providers within our network. And then because this is a priority for us, we have continued to include it in our AHP PCP reward plan as a citizenship component. It used to be just the Medicare line of business, getting over that 20% penetration, and we've expanded that out to an average across all lines of business, recognizing its importance. Oops. So, as I mentioned, how does this work? So you still bill for the visit encounter, and then you get the additional incentive of $175 for the Excellus line of business or Excellus lines of business. And then another thing that we've negotiated is a penetration bonus. This again is only applied to the AHP affiliated practices in our network. And so if you are above the 65% penetration by line of business, so you've got 3 opportunities to earn that bonus, you get an additional $50 for each visit that was completed. And so there are some, some financial opportunities as well as some care benefits. So this is a really great way to be involved. So speaking specifically about 2025, what's the goal? What are we trying to do here? So we are trying to achieve at least 75% penetration for the eligible Medicare members. Year to date, this is based off of data received as of last week. We are at 71%. So we've got a little bit of way to go. And we do think that we're going to make the goal. We're projected above the 75%, but we just want to make sure that we're not losing sight of the things that we can do to get us there. So a couple specific actions you can take if you are participating or your practice is participating in the Vatica initiative. Please talk to your providers. I know it's the end of the year. I know there are a lot of visits. I know they are all working really hard to see patients and provide great care. But as we look out to to the end of the year, just making sure that they're aware of the importance this has for AHP, the network, and also for them. You all receive the direct incentive, but because this is also included in our incentive plan, there's additional opportunity to earn there as well. Partnering with Vatica to schedule visits for eligible members before 12/31. Any patient who is seen up until 12/31, end of business in 2025, is eligible to be included in this network performance goal. So we really want to get those patients in if they are eligible, if they haven't come in for annual well visits and they need to be seen. Now is a great time to try and get them scheduled. I know schedules are probably not as accommodating this time of year, but whenever possible, we want to be able to meet that need. Reminding providers to sign visits within 14 days of the appointment. This ensures that we're not getting into my next bullet point, which is preventing locks. We really want to be able to keep moving through patients that are eligible for the population and not having to do double work for unlocking visits that have previously been prepped for providers. So there's, you guys have done really great work. This is, I think about when I started at AHP, where we were from a penetration perspective and a participation perspective, and we're signing thousands more visits than we did in 2021. So it's been really, really great work, and we're really appreciative. And so we're asking you to keep up the energy as we move through the end of the year. So I will also pause there and see if there are questions specific to Vatica before I introduce Mark, and I'll do that for you, Selena, since I'm already chatting, and I'll stop talking. So are there any questions about Vatica?
I have a question.
Yeah.
What do we do with the patients that are on the roster but that are actually not our patients?
Yeah, so this is an ongoing issue. We're working with Vatica and Excellus on appropriately aligning those. If you have specific examples of when that's applying, Amber, you can certainly send me like a secure email, and we can figure out if there's a way to show that and make it clear, so that we can get those patients attributed to the correct provider and correct location. But that's an ongoing issue and discussion that we're having with both Vatica, because I know they're trying to do some manual assignments, and with Excellus, so that we can recognize where these patients are actually receiving care.
Okay, thank you. I can let you know when I'm done working the list.
Okay, perfect. Thank you.
Yeah.
Anything else? Wow, I think we're going to be right on the money for 30 minutes. This is exciting. So I will go ahead and introduce Mark Cronin. Most of you should know Mark. He's been around forever, but he's our COO, and it's an exciting time in AHP. As we shared at our last practice managers meeting, we welcomed John Williford as our permanent CEO, and together, Mark, John, and the AHP leadership team have really been talking through what are our priorities, what are the things that we'd like to do going forward, what's our vision for how we work and the things that we're able to accomplish. And so Mark shared some of this with our internal team last week, and I thought it'd be really great for you guys to hear a little bit about how we're thinking through AHP's future. So with that, I'm going to let Mark take over and kind of walk us through our year-end priorities and our vision going forward.
Sure. Thanks, Jana. And, when Jana says I've been around forever, I think that's the polite way of saying I'm old. And it's probably true. But that's okay. But seriously, glad to appreciate the introduction. Glad to spend a few minutes speaking with all of you this afternoon. Appreciate that you took the time, during your lunch hour to attend our Zoom and to hear what's going on at AHP. So, one of the things I'd say, and I'll go over on this slide and the next couple slides, these really refreshed statements of mission and vision and future is, as I look at who's in the meeting this afternoon, I look at the chat and see the practices you're coming from. I mean, the heart of our network is here. I mean, if I look at all the practices here, you're the core of our network. You've been with us, most of you, since the beginning or near the beginning. So you know who AHP is and what AHP does, and you know our role in the value-based contracting and our work on the quality of care and the quality measures and the value-based contracting and gain share. And you know those concepts. So we certainly don't need to explain AHP to you. And I wonder if as you hear, hey, we have a new mission we'd like to show you, you may be thinking, oh, we already know what AHP's mission is. Is AHP making a pivot and going in an opposite direction? So the good news is no, we're not going in an opposite direction. We continue very much in the space and the work that we've been doing since way back in 2013 when we started. But as Jana, I think, said in her good introduction here with John Williford beginning as our new CEO, it's a time for any organization to take a look at what are our statements, whether you're talking mission, vision, values, and other things related to the organization. So, I think that's what we've done. Also, as John has come on board, and you'll see the wording, I think, is new and improved and tighter, and I'm going to go over it. But also, it's very much in the same line as we've been in, and we expect to be doing many of the things that we've been doing ever since we started in 2013, including providing resources to you, whether it's through the dollars that come through to your practices, the care managers that we deploy in your practices, et cetera. So I thought it was important to start there. So I'm a big believer in any organization's got to be clear and got to be explicit. Is what are we here for? What are we doing every day? So a mission statement is intended to say, what are we doing every day? What is our purpose when we show up for work every morning? You've seen the tagline, and I'm going to credit Jana, who was a leader in creating this a couple of years back, transforming healthcare together. I think it's a great tagline that we've created. We probably haven't been out there using it as much as we might. And I think you're going to see us displaying that more because that's really what we're trying to do. We're not trying to do the same old, same old. We're trying to get things better, right? We're trying to improve quality for patients, improve the experience for providers and their staff, really trying to transform healthcare. So you're going to see us display that more, transforming healthcare together. So if you look at what is our mission, what do? We bring together healthcare delivery organizations, medical professionals, and community health partners. Many of you on the call today, those descriptions apply to most of you on the call today. In an innovative clinically integrated network, and again, clinically integrated network, you've heard us use that phrase before. That's what we started building way back in 2013. Through aligned goals and data-powered collaboration, and we're trying to improve our capabilities in the data space so we can provide more and more information to you. And you've heard about Health Catalyst, and you'll hear a lot more about it in the future and the capabilities it gives us to provide meaningful data to you, our providers and our practices. And we're trying to elevate care quality and strengthen prevention, drive greater value across the region. That's what we're trying to do every day. That's our mission. That's what we're doing. So then if you go to the vision statement, which is usually intended to look out and say, where do we want to be? What's this future state that day-to-day work is trying to create? It says that we envision a healthier future driven by innovation, which has always been part of the spirit and the culture of AHP and the work that we do with you, our valued members of our network. So innovation, collaboration, again, that's why we convene these meetings. We want to meet with you, we want to talk to you and see what your needs are and see what your issues are and how we can address them. And integration, there's that word again, across medical, social, and behavioral health, which of course are the essential domains of our work. So again, key concepts there of where we want to be in the future. That's our vision as we've refreshed the statement. And then on the next slide, you'll see that we've adopted this. It's a future statement, which is a little bit different than a vision because it says, if you are successful, if you get to where you really want to be, what is it going to look like? So you'll see more and more organizations create these future statements of what does that great place that we want to get to, what does that look like? And it says we'll be recognized as a healthcare network of choice. And again, that network is you. It's your providers, it's your practices. Without that, AHP is nothing and doesn't have a reason to exist. So that network is you. So no, we're talking really about you, our practices. We will be recognized as a network of choice across an expanding region, as a trusted leader advancing innovative, there's that word again, coordinated and compassionate care. Through shared accountability, aligned priorities, commitment to measurable improvement, we will foster healthier, more connected communities with greater access to the care and resources needed to thrive. So as I talk to a group of folks here today who have dedicated, for many of you, your entire careers to healthcare and improving the quality of care and helping patients, if you look at this future statement, I am going to presume you look at this and you say, that's where I want to be. That's why I show up for work every day. That's what I want to create. And so obviously that's what AHP wants to do in partnership with all of you, ultimately to improve the care for the 400,000 patients under the AHP umbrella. So that's the exciting statement of future that we've created and that we want to get to. So then, to some extent, creating these nice words, that's the easy part. How are you going to accomplish it? And so we've created at a leadership level on our staff a set of activities and initiatives for 2026, which we've condensed for this slide right here of what are the things that we're going to do in 2026 that are going to keep getting us in the direction of that exciting future vision. We are going to be expanding our staff, and we try to be very careful about this because these are the dollars that our contracts generate. And ultimately, if we're successful, those dollars come back to your practices to provide the resources that you need. So we're always very careful in how we spend dollars on staff, but we've identified an opportunity to bolster our care management team, and we're going to be making some hires there on our embedded pharmacy team, and we're also going to be adding to our data analytics team. So very carefully targeted, selected staff positions in order to support new initiatives that we think are going to enable us to get to that future. The second bullet point, broadening our mix of insurance plan contracts, those are the dollars that come into AHP that we then use to provide the resources to you as the practices. Again, the resources being whether it's the dollar, the quarterly incentive payments that we make to you, our care managers, our embedded pharmacists. So there, as you know, we've had longstanding contracts with Excellis and MVP, and also with Molina, but there are others with who we don't contract with. So we've already announced that in 2026, for the first time, AHP is entering into a contract that'll be for straight Medicare patients through the ACO REACH program. We're exploring a couple others right now. So broadening our insurance contracts. Speaking of ACO REACH, the third bullet point is we're very excited to join ACO REACH. We've been in Medicare Advantage for many years with both Excellis and with MVP. So this means we need to create a universal strategy. How are we going to take care of Medicare patients, regardless of whether it's paid for as part of Excellis Medicare Advantage or straight Medicare? We need a universal strategy on how we're going to be successful in that line of business. And again, when we're successful, it means our patients got better care and there are more resources available for the practices and therefore for each of you. Second to last bullet point, it seems the only thing anyone's talking about these days is artificial intelligence. And so we're not immune from that. And we're actively exploring how artificial intelligence, we can deploy that in our day-to-day work to make it more efficient and effective. And so more to come on that as we explore a number of potential use cases. And then developing a new strategic plan, which is something, again, most organizations do this regularly every few years. We're due. And I think as we've adopted the new mission and vision statement and a statement of what we want to do in the future and the strategies that we're going to take to get there, it really sets us up to do that. And so more to come on that as we get deeper into 2026. So I'm going to stop there and know that as I've consolidated a fair amount of work our team has done in the last 3 months into 5 short bullet points. But no, there's a lot behind that. So I'll be glad to entertain any comments or questions that folks have. So as I said, a lot more to come on these items. And also I'd say feel free to reach out, if you, after the slide deck comes out or you listen to the recording, if questions or thoughts come to mind, you can certainly reach out to me or other members of our team and we'll be glad to answer your questions.
Thank you, Mark.
Sure.
So now we would like to open it up to you. Does anyone have any questions or topics that they'd like to discuss with the group?
And as we wait for those to maybe hit the chat or for folks to come off and mute, I would just encourage you all, as we're looking out to 2026, please don't be hesitant to send anything our way in terms of open discussion. We'd like to integrate them into our agendas so that these meetings continue to be beneficial for you all. Those topics can go straight to Molly, and we can, do any work in the background to make sure that we're coming to you all with responses and or topics that are relevant as they're taking place.
All right, I'm not seeing any questions in the chat, so we are going to move forward. Our meeting schedule for 2026 is listed here. Again, as Mark said, we will be sending the slides. This presentation will also be uploaded to our YouTube channel for your review if you wanted to revisit it. And we will send this out with the meeting follow-up as well. And just a reminder, yes, we are an AHP Accountable Health participating provider. So what does that mean for your patients? That means that you refer your patients to AHP specialists whenever possible, admit patients to AHP hospitals whenever possible, and send patients to AHP imaging labs whenever possible. For your practice, continue to monitor that provider engagement report, the PER. Lots of practices have been trained and are learning more about the functionality of that. Certainly reach out to us if you have questions as we're navigating the new dashboards. Attend these meetings as often as you can, accept, read, and share our communications, and help providers connect with AHP resources. And at the end of these, we always like to share important contacts here at AHP and then other participating groups that we like to send information on as well.
So I do see,
yeah.
I was going to say, I do see Pira. Thank you for adding your contact information in here. If you're okay, we'll just add it into this other contact slide for the GCH Office of Community Practice.
Yes, absolutely. Thank you.
So we'll make that update and then it'll be included in the follow-up.
All right, with nothing else there, 12:35. I'm sorry we kept you 5 minutes.